name is Emily. Today my group members Monty, Shannen, Sanjana, and I will be discussing mental illness, how to maintain good mental health, how to receive mental health services, and the intersectionality between homelessness and mental illness. At the end, we'll practice some deep breathing and learn how to massage our pressure points to de-stress.
So, what is mental illness? Mental illness includes a wide range of disorders of thinking, emotions, and behavior. And there are many different types of mental illness, and it can be short-lived or long-term. And occasionally, it can be hard to tell the difference between mental illness and normal worries or sadness. But mental illness is more severe, it lasts longer, and significantly affects a person's ability to cope with life. Almost half of adults experience symptoms of mental illness at some point, and depression is the most common. Disorders fall into broad categories, including anxiety, mood disorders, schizophrenia, personality disorders, OCD, and other mental illness disorders include eating disorder, stress disorder, such as PTSD or suicidal behavior. Mental illness is caused by many different things, in combination including inherited factors, life stresses, environmental and culture you live in, health problems that affect your brain. The main treatment are medicine and counseling. Family and friends and support groups can help people cope with mental illness.
Just like staying fit, maintaining good mental health is something that takes effort for everyone. If you put in the time and effort to take care of yourself, you will likely see improvements in your day-to-day life. The Mental Health Foundation UK has made a list of 10 commonly recommended strategies for staying mentally healthy. The first is to talk about your feelings. Although you've probably heard that before, there's a reason. Mental health professionals say that those who report regularly talking about their feelings to other people are more resilient in the face of negative circumstances. Along with this, it's important to stay in touch with loved ones. A strong support system can result in a sense of security that can help you stay mentally healthy. Other factors that contribute to a positive mental health are staying active, eating well, and sleeping for at least 8 hours a night. Simply put, your brain is a part of your body too, so in order to keep it healthy, you must also keep your body healthy. Lastly, it's important to carve out time to rest and simply enjoy yourself. Take part in a hobby, play with other people, and make sure you have some time that you can just rest.
Like Shannen just talked about, it's super important to try to maintain good mental health. But if you are struggling with mental illness or mental health in general, it's crucial that you find help. There's absolutely no shame in asking for help or talking to someone about mental health. Unfortunately, there's a lot of stigma surrounding mental health, which means that there's a negative attitude towards mental health topics, and people view them as something that shouldn't even be discussed or as something that isn't real. This makes a lot of people afraid of bringing up mental health or seeking out help with it. It's so important not to stigmatize mental illness and struggles with mental health because they are very real and it's very important that they be addressed. Seeking help with mental illness is no different than seeking help with other health issues like a cold, diabetes, or cancer. With that being said, there's some different things you can do to seek out help. One of the most important ways to get help is to talk to someone about what you're going through. That person should be someone you trust. It could be a sibling, a parent, a friend, a teacher, a counselor, a doctor, or anyone else in your life that you trust and you feel comfortable talking to. But if you don't feel comfortable talking to someone you know about what you're going through, there are lifelines and hotlines that you can call or text for help. Some examples are the National Suicide Prevention Hotline, Hope Line, and the National Alliance on Mental Illnesses Hotline. Their phone numbers are shown here on the screen.
As Sanjana was saying, it is very important to seek help to improve one's mental health. Unfortunately, in America, it can be very hard to access mental health services, especially if you are unemployed or work at a minimal paying job. Without getting too much into the details, in the US, our employers usually provide us with health insurance. Health insurance helps us pay for medical services such as going to a psychiatrist. For those without employment or for those working low-paying jobs that do not provide health insurance, the US government provides a form of public health insurance called Medicaid. Unfortunately, many psychiatrists and psychologists do not accept Medicaid because Medicaid pays these professionals very little. Therefore, those who fall lower on the socioeconomic ladder have a harder time accessing mental health services. For individuals with serious mental illness, serious mental illnesses such as schizophrenia, bipolar disorder, or obsessive compulsive disorder, receiving consistent mental health services is especially important because their symptoms impair their ability to maintain relationships, find employment, and execute their other tasks. If they fall lower on the socioeconomic ladder, they will have a harder time accessing these services, and some end up experiencing homelessness. Homelessness and mental illness exacerbate each other. For someone with a mental illness experiencing homelessness, seeking medical help and finding stable employment are very difficult. Sanjana discussed that it is important to not stigmatize the mentally ill, and it is especially important to find your compassion for those with mental illness experiencing homelessness. We hope that you realize that circumstances outside of their control may have led to their predicament.
Today we'll be going over some techniques to de-stress. The first method we'll go over is deep breathing. As I count up to 4, I want you to breathe in through your nose. We will then hold our breaths for 4 counts. Then as I count down to 8, I want you to breathe through your mouth like as if you were blowing through a straw. Okay, let's close our eyes and begin. So let's all close our eyes and let's breathe in for 1, 2, 3, 4, and hold 1, 2, 3, 4. And breathe out 8, 7, 6, 5, 4, 3, 2, 1. Okay, one more time. Breathe in for 4. 1, 2, 3, 4. Hold 1, 2, 3, 4. And breathe out 8, 7, 6, 5, 4, 3, 2, 1. Yeah, so deep breathing helps lower your stress, lower your heart rate when you're feeling anxious, stressed, or angry. Yeah.
So next we're going to be massaging some pressure points. So the first one is between your thumb and index finger. So take the thumb and index finger from your other hand and then press firmly on the webbing between your fingers and massage firmly for 4 to 5 seconds. And while you're doing it, take slow and deep breaths. There you go. So that's supposed to help relieve stress and headaches.
Next, we'll be massaging our ear, and we'll be massaging like upper shell of our ear at the tip of our triangle, like hollow there, and apply firm pressure in a circular motion. This helps relax, this helps relieve anxiety, stress, and insomnia.
The last pressure point we'll massage is at our shoulders. To find it, pinch your shoulder muscle with your middle finger, thumb, and massage the point for 4 to 5 seconds. It can be a bit tender, so don't pinch too hard. Thank you for tuning in. We hope you learned something about mental health.
Thank
you.